Sickle-cell disease will only manifest if the offspring inherited two defective genes.
Because of the blockage of these little capillaries that supplies blood to the tissues and organs, we often notice growth retardation in these young children. Apart from that, because the blood vessels are equally blocked, we notice that insufficient oxygen flow to the organs and tissues arouses very painful crisis in these young ones. And of course, this is what makes them very well known in the environment they live in. They are always weeping and crying of this painful crisis. Similar painful crisis occurs in the chest region because similarly of the blockage of these blood vessels. We call those acute chest syndrome. Acute chest syndrome is when these sickle cell disordered patients cry because of the severe chest problems that they have. Another great problem that befalls these children is what we call the splenic destruction. The spleen, as we know, is in fact the center, or let me call it the burial ground of dead blood cells. So when so many red blood cells are destroyed in a sickle cell disordered patient, we have the symmetry of the dead cells overpacked. And as a result of this overpacking, the natural function that is normally meant for the spleen does not go on well. The spleen is known to be one of the big centers of immune system buildup. And when it is occupied by so many dead red blood cells, it reneges on the natural work that she should have done. So we have in these children also a drop in the immune system that the spleen should have done. Furthermore, when we talk about blockage of blood vessels, let us remember what happens in the brain when the blood vessels are blocked. Like I said, this clump formed by these sticky red, sickle red blood cells could go ahead and block the brain blood vessels and lead to stroke formation, even in little children. I have had such a patient, a 3-year-old sickle cell disordered girl who was brought home from America and on arrival here suffered a severe crisis which led to the development of stroke in her. And luckily, I was aware of what had happened, and it took giving this child some IV infusion, and within a couple of hours, she was well again. Now, we also talk about the incidence of gallstones in these children, because massive destruction of red blood cells cause a massive release of bilirubin into the circulation, and it is this bilirubin that in fact aids in the formation of bilirubin or bile stones, bilirubin bile stones, and that occurs, gallstones occurs in them. Of course, we have blockage of blood vessels in the bones leading to bone infarction, bone infarction which leads to pathological fracture of these bones if it remains chronic. We have the leg ulcers, the wounds that never heal in sickle cell disordered patients. But worse still, what really makes it horrible and pathetic to these young boys, males if they are males, is the priapism. That is, they develop erections that never wants to stop because the blood vessel through which blood should have flowed out in order to reduce their erection is blocked. So this blood does not get, these blood vessels do not open up, the blood does not leak from the erected penis, and this keeps the erection on and on, sometimes for days, and unfortunately sometimes it may lead to the destruction of the penis if care is not taken.
The World Health Organization believes that everyone living in malaria endemic area should know their genotype. Some organizations make it mandatory before marriage. This should be encouraged. But how do we manage the numerous complications?
Everybody says it, even from primary school level. They say prevention is better than cure. Prevention is better than cure. If you can protect these fragile sickle cells, protect them from oxidation and hemolysis or from crisis, there will not be need to see them suffer all these consequences. So first and foremost, what I would like to say is that what we need to do is to protect these fragile sickle cells with antioxidants which protects them against the oxidation that occurs to them. And like I've always said, when you talk about prevention of oxidation, the numero uno substance that you put in the line is Jobelyn, because it's so easy to deliver. Once you give it, within a couple of minutes, the antioxidant is being expressed because of its bioavailability. That is, it is easily absorbed, it is easily circulated in its effective form. Furthermore, we want to talk about substances that protect the wall of these sickle cells, because once the wall ruptures and breaks open, that is the end of the show. So we talk about substances like zinc, magnesium, calcium, folic acid, which helps to protect the cells of this weak red blood cell. 3, you have to drink a lot of water. If you drink a lot of water, it will help to improve the circulation in a sickle cell disordered patient. Prevent and control malaria and all kinds of infection. That is why they should take Polidrine daily, or make sure that they don't fall into the wicked hands of malaria. We have told you that the spleen, which would have helped in promoting their their immune system, will be down because of overloading of the spleen with dead red blood cells. Infections, look for the best antibiotics to give them to suppress the infection as soon as possible. They always go through very severe pain, so you need powerful analgesics. Give them powerful analgesics. Unfortunately, once they get you to these powerful analgesics, you have to go ahead and step higher and higher. Some of them even have to get morphine to relieve their pains. But definitely your doctor will have this solved for you. And sometimes they may need oxygen inhalation in the early stages of the crisis so that further hemolysis will not occur. That is why we recommend and advise that all doctors should have oxygen inhaling equipment at readiness, always filled with oxygen in their hospitals in case a sickle cell disorder could be rushed in. Well, even though we don't support transfusion of blood to these poor souls, we always recommend that in very severe situations, so that we don't lose them, we should very, very carefully. It has been discovered that very slow and very careful blood transfusion is necessary, irrespective of how low the hemoglobin or PCV may be. Please don't get over anxious in overloading these poor souls, because it has been discovered that they react very easily to blood transfusion. Now, of course, we have been talking about research programs. There is this substance called hydroxyurea, which was formerly a chemotherapy, which is used to reverse this sickled form into the fetal hemoglobin. We have Nicosan, which was sponsored by the federal government for the reversal of this sickling. Bone marrow transplant has been put into order. It is effective in children. It is expensive, but it is very risky. And we've also been checking into genetic engineering, which we hope in the future will be of help. But unfortunately, the unavailability of these substances makes it, you don't really have much choice. I mean, we cannot talk about bone transplant in third world countries or all this big sounding genetic engineering. So I am stressing it once again. Go for Jobelyn. It's very simple, ladies and gentlemen. Swallow this Jobelyn every day of your life, and you will protect your sickle cell from damages.